How are you?
Great.
Are you ready for your 73 questions?
I think so.
All right. Well, for those who don't know you, what is your name?
Ramkrishna Patel,
And what is your specialty?
Interventional Radiology.
How many years have you been practicing?
1,
Where did you go for your undergraduate degree?
University of Delaware.
What medical school did you attend?
Jefferson Medical College.
Did you take any gap years before going to medical school?
None.
What was your favorite part of medical school?
Anatomy.
What specialty did you think you were going to choose when you entered medical school?
Pediatrics.
What made you fall in love with vascular interventional radiology?
The ability to treat someone from head to toe in multiple different ways.
All right. For those interested in being in vascular interventional radiology, how many years of school did you need after medical school?
It's 6 years of training with residency and fellowship.
How does it feel to be a part of the Vascular Institute?
I am so grateful that I fell into this job. Happened to see this post, reached out to Dr. Petruzzi, and as they say, the rest is history. This is a dream job coming out of training.
What would you say is the most unique part of your specialty?
I think it's our ability to get almost anywhere in the body, all through a little needle stick or a pinhole. I can't think of anyone else that can treat the variety of things that we can treat without needing to use a scalpel, frankly.
Why should medical students choose your specialty?
Because it's the best.
What are the stereotypes about your specialty?
You know, I think we've done a really good job of dispelling one of the biggest stereotypes, which is we don't have clinical follow-up. We run our own full clinics, see our patients pre, during, and post-procedure with full scope of follow-up. So, you know, I think that's one of the biggest, that's one of the more maligned things about interventional radiology, and I think it's changed very much in the last few years.
How many patients do you see in a day?
Somewhere between 15 and 20.
What is the most number of patients you've seen in one day?
Ooh, maybe 25?
How many studies do you see in a day?
Infinite, no. I guess a few per patient, so I can see if I'm, on a reading day, I may read well over 100 studies. On a day that I'm clinical and seeing patients, I guess the same number as I see patients, because there's typically imaging associated with my patients.
What is your favorite procedure to do?
I love embolization procedures. So it's the best form of treating someone, and I think that they have the greatest outcome when we see them a month later, and whatever reason they came in to see us, they are significantly improved, and you can see the change in that patient.
That's what you love to hear. How many hours do you work in a day?
Ooh, that's tough. In the clinic, 10. Home and clinic, if you ask my wife, it'll probably be like 18.
What time do you normally wake up?
I'm a 5:30 guy.
What time do you usually leave the Vascular Institute?
Normal day, 5:30. Otherwise, it could be any time.
Do you work more at night or during the day?
During the day.
What is a unique medical fact that you will never forget?
A gossipaboma. Go figure out what that is. No, I'm just kidding. It's the name of a retained foreign object after surgery within someone's body. When seen in a radiologic study, it's called a gossipaboma. I think it's the coolest name.
How long does it take you to chart?
Somewhere between 5 and 10 minutes between patients.
What is the most common medical advice you would give your patients?
Don't go to Dr. Google.
What are you looking for most here at the Vascular Institute?
A lifelong job.
All right, well, let's talk about you personally. What is your favorite thing to do when you're not working?
Play tennis or pickleball.
Do your family members ask you random medical questions?
All the time.
What is your favorite animal?
A lion.
What is your favorite color?
Red.
What is your favorite purchase?
Technology.
What is your favorite hobby?
Tennis.
Do you collect anything?
No. It's weird.
If you could have dinner with anyone, past or present, Who would it be?
Rich Gannon.
Coffee, tea, soda, or water?
Coffee.
What is your favorite lunch to have while working?
Broad spectrum, Indian food. Focused, mutia.
Pineapple on pizza?
Yes.
Yes or no? Whoa, that was a quick yes. What is your favorite meal to eat?
Anything from Carluccio's.
I agree, they have great food. What are your top 3 favorite music artists?
Skip.
What are your top 3 favorite songs?
During my cases, I'm always listening to Dance Monkeys.
Okay. What is your dream career?
Interventional radiology.
How do you relax after a work day?
Hang out with my daughter.
Do you prefer nights in or nights out?
Nights in.
Beach or mountain?
Beach.
Walking or running?
Walking.
Are you an introvert or an extrovert?
Extrovert.
Is this why you chose your specialty?
Yeah.
Can you share a fun fact about yourself?
I was born in India. I came here when I was 9, and I can turn on the accent whenever I want.
What did you want to be when you were a kid?
A doctor.
Is there a different specialty you think you would have done?
Knowing what I know now, absolutely not.
If you didn't go into medicine, what other careers do you think you would have pursued?
Frankly, I don't know, because this was the only thing.
If you could change one thing about the medical field, what would it be?
Bureaucracy.
What can a potential medical student do now to prepare for your specialty?
Spend some time shadowing an interventional radiologist. We'd be happy to see you here.
What advice would you give to an aspiring medical interventional radiologist?
Figure out what you really love to do in terms of procedures and find a job that'll allow you to do that.
Lastly, what would you say to your current and future patients?
Come in and see us. You'll have a good time, I promise. I'm Ramkrishna Patel. Thank you for watching, and if you have any further questions, you can reach out to us at vi-ami.com.